Thank you. So, yeah, I'm John Holmes. I'm a founder and employee of Microsoft Diagnostics. That's my disclosures. So this was, what I'd like to talk to you about today is just the initial impressions from a study we've been doing to look at how AI could actually be used as a tool for clinicians using OCT to assist them in their practice. AI is talked a lot about as something that could replace, but how about using it as a tool to help? Two ways we looked at. One was to identify image markers in OCT for basal cell carcinoma, and secondly, a method for processing the images to make those image markers more visible. And what we did is we applied these tools to OCT scans obtained retrospectively from a study of non-invasive treatment for BCC performed at the Danish Research Center for Skin Cancer at University of Copenhagen, Denmark. So here is a typical BCC. You can see on the clinical dermoscopy and histology, and bottom right is how you might see this in an OCT image. So you see this sort of darkened area. And this is a sort of task that the user of OCT is using, they're using daily to actually identify these BCCs in their practice. So the question is, can we automate this? The challenges are that the user has to learn, and that typically takes time to practice on up to 100 OCT scans to become proficient. And even when you've done that, each individual scan comprises about 120 image frames, and you've got to look at each one. And that has potential for observer fatigue and affecting the accuracy. So we developed an AI, and we trained it to identify image markers for superficial and nodular BCC types. We also used that to calculate the volume. We performed this analysis on scans done at baseline and 3-month follow-up. So then we also compared with the unaided results. So here's an example scan. Experts might be able to already identify something that's a BCC, and this is where the overlay showed where the trained algorithm identified the BCC, also shown as a box. And then when you look at the whole image stack, which is a 3-dimensional stack, the blobs showing where it identified BCC fragments. And at 3 months, it has shrunk, a little smaller thing, and we see a reduction in the tumor volume, reduction in 93% as a response to treatment. This scan was a little bit more demanding because of the presence of hairs causing shadows, but we were impressed that it actually found the tumors quite successfully. And in this particular case, the tumor actually grew. The effect had and we actually able to measure that as well. So some of the things that we found from this initial results were that first of all, the tool found all of the BCCs, which was very good, but it also reduced the search time because the AI immediately showed the frame with the highest score for BCC. So that was a help to the user. It, of course, searches all the image frames and misses nothing, and it really generally made the image interpretation task somewhat easier. And it can also do a thing that the human observer cannot easily do. In other words, it can measure the volume. The second thing we looked at was to increase the depth enhancement of OCT images. Anyone who's looked at OCT images will see that the intensity falls off with depth, and so that means that images that are deeper may be in focus, but actually quite hard to actually discern. So what we can do is we can use an algorithm to actually measure the reduction in intensity and to boost that intensity with depth. And that needs to be done on every scan because every piece of tissue is differently. So here's an example of the starting image. And then here is an example of the enhanced image. And I think you can see there is more depth detail. Easier to see the lower border of the tumor for assessing the depth. And same with this one. So depth enhanced image definitely reveals more detail in depth. So in conclusion, AI and algorithms can aid the OCT user for fast identification image markers, enables 100% assessment all image frames, automatic calculation of statistics, improves image clarity and contrast at greater depths, and it makes the whole thing, image interpretation, faster, easier, and more thorough. And our next step is to report and quantify these efficiency and accuracy improvements, and we'll be doing that later this year. My thanks to the team at Danish Research Centre for Skin Cancer and to colleagues at Manchester Imaging Limited for the algorithm development. Thank you.